the future is, I think, to replace Eculizumab. Again, Eculizumab is a very successful and effective molecule, but because it's infused every 2 weeks, it's logistically difficult for a lot of our patients, sometimes because they have to go to an infusion center and they might be immobile. Sometimes it's venous access. So for those, and actually the cost of Ravulizumab is a lot less than the old Eculizumab. So there are a lot of reasons that I think Ravulizumab is going to take the share of the market that Eculizumab currently takes. And I think that an every 8-week option is just more feasible and logistically doable compared to an every 2-week drug.